There are a lot of bad advertisements out there. I'm talking Cars for Kids, 877 Cash Now, the SPCA field recovery, field deployment footage, the Lumi butt crack pits and privates lady. But few ads are more annoying than the direct-to-consumer drug advertisement. On this episode of Touring with Tia, I grill AI Big Pharma to try to get to the bottom of its stupid ads. Stay tuned. I promise I will neither sing nor dance. So tell me, why are the people in direct-to-consumer drug advertising so unlikable?
There are a few reasons for that. Sometimes the people in those ads are meant to represent the challenges someone might be going through, and it can be easy to come off as whiny or overly focused on their problems. Also, the ads are often short, so there's not a lot of time to develop a really likable character.
Why are these ads undergirded by such fake activities and idiotic behaviors? For example, group hedge clipping, a guy getting off a bus in a leather tunic to go to a Dungeons and Dragons convention, people walking off their jobs and abandoning their children to walk down the street with total strangers.
The thing is, those ads are often trying to reach a wide audience, so they need to include things lots of people can relate to. Some of those situations might seem silly, but they're meant to represent common issues or things people might dream about.
Why is there so much activity in general in those ads, especially the dancing?
Sometimes it's meant to show how much better the person feels after taking the medicine, or the dancing might be meant to be memorable, so the ad sticks in your head.
Why not feature more practical behaviors that patients struggle with? For example, opening jars if you have arthritis, or ignoring a glucose monitor and eating a donut, or like a guy rolling over in bed, super disappointed in himself because he couldn't perform.
Focusing on the practical stuff would probably connect with people on a different level. Honestly, it probably comes down to what the company thinks will sell the most medicine.
There are only two countries in the world that allow these ads on TV or allow these ads to be played directly to consumers, and that's in the United States and in New Zealand. So why are we seeing these ads at all?
The thinking is that patients should be empowered to have conversations with their doctor about all their options. Drug companies also argue that these ads can raise awareness about medical conditions people might not know much about. Finally, let's be real, it's a multi-billion-dollar industry. Drug companies have a vested interest in staying competitive, and advertising is a big part of that.
I am a little shocked that, like, given that you're a spokeswoman, excuse me, for the pharmaceutical industry, that you're so reasonable.
Look, I get it. Drug ads can be frustrating. Maybe if enough people complain about them, the companies will get the message. You're not the only one who feels this way.
Oh, we'll get to complaining. What's the FDA's role in regulating direct-to-consumer drug advertising?
First off, they make sure the information in the ads is accurate and balanced. Second, the FDA wants to make sure drug ads aren't misleading or deceptive. And lastly, the FDA has the power to take action if a drug ad breaks the rules.
Why is there a total lack of any emotion in those ads other than absolute glee?
That's an interesting point. It'd be weird to see someone crying in a drug ad, but a little more emotion couldn't hurt.
I read in an article the term sea of sameness in relation to these ads, and they do seem to follow a very similar formula. What is your sense of this?
Many of these ads are produced by the same big advertising agencies. These agencies have processes and formulas that work, so they tend to stick with what they know. But I think the biggest reason for the sameness is that it's just what sells. People respond to certain types of ads, so companies keep making them.
Recently, I got pink eye from hanging out with little kids for about 2 weeks. And I went to the doctor. I got a very inexpensive drug, cured it in 5 to 7 days. And I realized I am never going to see a drug ad for pink eye medicine with, choreography and a jingle, because that is something that's easily cured. I will only see ads for chronic conditions that cannot be cured but can be managed, and perhaps over a lifetime, making these drugs extremely profitable.
Okay, here's the deal with those fancy drug ads. It all comes down to what the drug companies call market potential. They figure out which drugs have the biggest chance of making a ton of money, and those are the ones that get the big marketing push. Think of it this way. If a drug treats a super common condition, like high cholesterol, there's a huge pool of potential customers. That means they can justify spending a lot of money on fancy ads to reach as many people as possible. On the other hand, a drug for a rare disease might work wonders, but there's just not as big of a market for it. Make sense?
It makes total sense. And do you know that you're going to get fired? Like, do you not like your job because you're going to get fired? How common is erectile dysfunction in America?
It's hard to give a super accurate number, but studies show that anywhere between 30% to 40% of adult men in the US experience some degree of erectile dysfunction. Is there anything else in particular you'd like to discuss?
Yes. Now, I do have some favorite ads. They're not all horrible. I actually really I like that little gut guy that would run around in the tailgate parties and was high-fiving people, but I haven't seen him in a while. Has there been a reduction in the use of mascots in direct-to-consumer drug advertising?
It's funny. I haven't seen as many mascots lately in drug ads. It used to be a thing, especially those friendly pill characters. Maybe the drug companies figured out that people wanted something a little more. Well, grown up. Could be that they're trying a different approach. Or it could just be a phase.
Yeah, I don't think people have grown up. Like I don't see that little Cologuard test box guy anymore. He seems to have disappeared.
I remember that guy. He was pretty distinctive. Maybe the company decided to go in a different direction with their advertising. Or it's possible his contract ended and they haven't found a replacement yet. You never know with these things.
Why would a highly educated professional like a highly educated and trained professional like a medical doctor give patients drugs that patients saw on TV simply because the patients asked for them?
If a patient seems really set on a specific treatment, it can be easier to just go along with it instead of getting into a whole debate. Doctors also want patients to feel heard and respected. Honestly, it's probably a mix of different factors. Heavy workloads definitely play a part in that.
Okay,
Changing topics. What's on your mind?
lightning round. Lightning round means yes or no to the questions. No periphery, no extra curricular words. What am I trying to say? No
Okay,
extra verbiage. Thank you for understanding. Do patients succeed in getting the drugs they ask for from their doctors?
Yes.
Are the side effects of all these drugs, in fact, uncontrollable singing and dancing?
No.
Since I have the right to tell my doctor what drug to prescribe me, do I also have the right to stand behind her and critique her gynecological exam skills, her skill in inserting a colonoscope, or her skill in, say, tying off hemorrhoids?
Yes.
Oh, wow. I don't want to do any of those things, just to be clear. Should I take an advertised medication if I'm allergic to the advertised medication?
No.
Is a Cologuard test just as good as getting a colonoscopy?
No.
Hmm. Telling you, my friends out there. Is Peyronie's disease either deadly or dangerous?
No.
The FDA oversees what's called the Bad Ad program. It is a program that, quote, empowers both the general public and healthcare providers to identify and report potential sources of drug misinformation. Can this number, 1-855-RX-BAD-AD, be used to complain about a drug ad that people just plain dislike?
Yes.
So, oh, it can be? I can call 1-855-RX-BAD-AD and just complain about an ad that I don't like.
Yes, you can call 1-855-RX-BAD-AD to report any drug ad that you think is misleading or inappropriate.
But if we just hate it, can I call it and just go, I hate this commercial?
Yes, you can use the FDA's Bad Ad program to report any drug ad that you think is misleading, even if your complaint is just that you personally dislike the ad.
Okay, folks, well, you heard it here. Give a call. 1-855-RX-BAD-AD to complain about direct-to-consumer drug advertising that you find terrible.
That's terrible.
I would like to thank my lovely guest for joining us on Touring with Tia, and I thank you, my audience, for again joining Touring with Tia, be sure to pick up the phones and dial 855 RX bad ad to register your complaints about all the schlocky drug ads out there that are working your nerves. Until next time on Touring with Tia.
Thank you for having me on the show. It's been a pleasure discussing direct-to-consumer drug advertising with you and your audience. Safe travels to you and Tia.
Oh, yeah, thanks.